And it is now time for our health check segment, and this morning we will be talking about sickle cell and the survival gap. And I am pleased to be having with me in studio three guests, beginning with the far end, seated at the far end, that is Selina Olwanda Ogweno, and she is a caregiver and sickle cell advocate. Welcome to the program.
Thank you.
And then we also have Moses Odongo Apela, who's a clinician at the Baraka Healthnet. Welcome to the show. And then we also have a sickle cell warrior and advocate, that is Teresa Adhiambo. Welcome to the show.
Thank you.
It's a pleasure to have the three of you here so that you can get to just educate us more on matters sickle cell. And if we may just begin, maybe I'll begin with you, Moses, just for our viewers to get to understand sickle cell. When you talk about sickle cell,
yes.
What is sickle cell?
Good morning, viewers. Today is a day that we want to understand what is about sickle cell. Sickle cell is a genetic inherited blood disorder that is basically inherited from two parents who are basically having sickle cell trait, both of them having sickle cell trait, for them to pass it over to the children.
Mm-hmm.
Yeah.
That is what sickle cell is.
Yes.
And when we talk about the survival gap,
yes,
when it comes to sickle cell, if you can just paint that picture for us.
The survival gap, basically with the advanced medical interventions, we don't have a specific timeline that we can say that a patient can live in terms of surviving with sickle cell. Mm-hmm. We have different ages. We have so many patients who are having lived of the disease. We have, like for example, in our facility, I have a patient who is around 57 years. So then it means that the survival gap is dependent on the good health care that these patients will be getting from the time of the onset of the diagnosis.
Okay.
Yeah.
All right, Teresa, I want to come to you. You know, you are a sickle cell warrior. Maybe if you can just talk us through, you know, when the diagnosis happened for you. This is something that someone is born with, but sometimes it is diagnosed late. Yes. So if you can just let us into that, Teresa.
Good morning, I'm Teresa. I was diagnosed when I was 6 months old. I was not very aware. I was told maybe later in life. But one thing my mom told me was, like, I kept falling sick and they didn't understand exactly why. So maybe they thought it was colic or something else, but upon further investigation, they took me to hospital and they realized that, one, the eyes were yellow, and two, you're very tender to touch. Like, as a baby, you wouldn't really know, because babies don't know how to communicate.
Yeah. So
it was like you're tender to touch, like the body was painful, but they didn't know why. So I think the doctor had suggested to them to do the sickling test, and that's how they discovered that I have the trait and I am a carrier. Yeah.
Selina, you are a caregiver, I believe, to maybe a child who has sickle cell.
Yes.
From your perspective, you know, as the caregiver, maybe how was that like for you, even in discovering that maybe, you know, this child has sickle cell, and just how has that journey been like for you?
Okay, I never knew about sickle cell. I saw a few people and didn't pay much attention. But then when I got my son, 6 months down the line, he started presenting the symptoms, which were not quite obvious to us. But then there were signs that could have led to us knowing that he has sickle cell. And so we got admitted for some 10 days. He got treated and we went back home. He was jaundiced. At that time he had vomit and diarrhea also as one of the symptoms. And then he was just lethargic. So when we went back home, things went back to normal. And then one of the things I noticed is that he was always jaundiced. And so because he was a premature baby, they used to tell me the 10 o'clock sun, the 5 p.m. sun would be able to clear the jaundice. And then when he turned 9 months again, the same thing happened. This time again we were admitted, and 10 days into the hospital is when then one of the doctors comes in, and the interesting thing is she requested for his surname. And I was very offended, like, why would a surname be associated to a disease?
Yeah.
And so they tested for sickle cell. During our time, it took a bit of time to get the results, so it took about 2 weeks. And when I went back for review, it was when I was told he has sickle cell anemia. Of course, it's shocking. It's devastating, considering that we never saw many people living with sickle cell, and the myths and misconceptions that we had out there were that people living with sickle cell cannot live to a certain age.
Well, what was the correlation between the surname and the trait?
Yeah, so sickle cell has always been associated with people who live within the malaria endemic areas.
Okay.
And so coming from the lakeside and being that it's a malaria endemic zone and it's a place where they see more sickle cell, I think that's why she asked for the surname. It was quite some time back. So I think those are some of the things that they would use to determine if a child has sickle cell.
Moses,
Yes.
you know, for both Teresa and Selina's son, the symptoms started showing at 6 months.
Yeah.
Is this usually the case, or and also you can let us know what are some of the early signs that maybe parents should be looking out for?
Yes. The signs and symptoms of sickle cell really doesn't have a timeline. We have patients who present, like for example, the one for Selina, who presented at 6 months, 9 months. We also have those ones who present later in life. I've seen one at 15 years. Basically, the determinant of the onset of signs and symptoms will be what we are checking here is the abnormal hemoglobin. There is abnormal hemoglobin called S, which is the dominant genetic predisposition that we inherit from our parents that will make your child to be having sickle cell. If this abnormal genetical makeup is high in percentage, then the symptoms will be presenting early in life. If you have a higher percentage of the hemoglobin F, for example, then you will realize that your child will be having less of the severe forms of signs and symptoms. The early signs and symptoms of this disease, basically, as Selina has mentioned, from her son, the first thing that parents will be alarmed of is the yellowness of the eyes. They'll start having the jaundice, which we call the jaundice. The other thing is these are children who will be prone to having fevers. The parents will be telling you that most of the time my child is running high fevers. The other thing is bouts of pains. The pain could be in different parts of the body. It's not only specific areas. The other thing, they could be presenting with swelling. The swelling, this is very common in the young ones, probably under 5. One of the things that this child will be coming to the facility complaining is either they are swollen on the fingers, the hand, the feet. The other thing is the pain could also be either on the stomach. So pain is not just confined in one area. The other thing is delayed milestone. Delayed milestone, basically, if you look around, there are those patients children who are born of the same age, but when you try to look at their development, you realize that the one who is having sickle cell, the parent will either tell you that my child probably, like for example, reaching 1 year is supposed to be walking, but their children, the child is not able to start walking at that time. So basically they present with delayed milestones. The other thing is they'll be presenting with abdominal distension. This abdominal distension could be because of there are things we have the internal organs, one of them being the liver, the other one being the spleen. So if you have excessive destruction of these red blood cells, it is the responsibility of these organs to remove them out of your system. And that is why we have the jaundice, which is coming, which is supposed to be from the liver. So one of the presentation that the child will be complaining is, or the parent comes to tell you that I've realized that my child, the belly is just increasing in size. Yes.
Now, since this is a condition that one is born with,
Yes.
shouldn't we be having these screenings at birth?
Definitely. That is why today we are here.
Yeah.
And there are a lot of advocacies that are going around from different players, either from the facilities, we are taking them to the schools, we are taking them to the barazas. We are making people to understand that sickle cell is a disease that was there in 1940s, not even just the other day. And what we are now encouraging is early screening, premarital screening. We're also encouraging mass screening. We have always been doing other activities, like for example, we do awareness through football matches. This is just basically to make people understand that Selina talked about the region, about the surname. People do think that sickle cell is just for a certain region, but I can tell you that in this era that we have intermarriages, then it doesn't only mean that if you are coming from Western Kenya, you are coming from the coastal region, or the regions that have got large water bodies, then you are the only person who is a high candidate to have sickle cell. We have seen scenarios where we have other regions which originally didn't have issues with the sickle cell, but because of intermarriages, now we are having these new diagnoses from these particular tribes. So the most important thing is starting to screen at early age. Let's do this awareness, let everybody come to understand, and especially even just what we are doing today, we are doing sensitization. Everybody who is watching us, wherever they are, at least now they have to understand that sickle cell is there. Let's do the screening, and especially the ones who have already had an history before. You have a cousin, you have a family member who have been diagnosed of sickle cell. These are most priority areas that we really want to screen them. Yes.
All right. Teresa, I would love for you to just let us in on maybe how, or if at all, sickle cell has been able to affect your everyday life, your social life, when it comes to education, and how that looks like.
Maybe I'd rush you through growing up sickle cell.
Yes, please.
When I was in primary school, he's described a condition called dactylitis, where your fingers get swollen. So I remember one time I didn't do my homework because I couldn't write, I couldn't pick up a pencil. My fingers were swollen. And the teachers didn't understand. So, of course, in the 90s, there was corporal punishment for not doing homework. I remember being beaten thoroughly for not completing it. And my parents didn't understand why I was being punished for not being able to comply. So my father had to take his time off from work to come and talk to the teachers and the principal and tell them, wait, this lady is different from the other children, so do not treat her the same. So when he was told the reason why we've punished her is because she didn't complete her homework. And then he asked, did you see what her fingers look like? And I remember my fingers were really swollen. And I didn't understand what it was back then, but later on now when you read for yourself, you're like, oh, it's dactylitis. And yes, it does affect children, but I've come to realize also as an adult, when the weather is really cold, I do have that condition too. But of course you don't tell everyone about it because you also don't want to be treated differently, yes. As a kid, I also remember wanting to run, and my mom always yelling from the window, why are you running? And you know, as a kid, you don't understand. Everyone else is running. Why am I the one who's not supposed to be running? And then, you know, in the evening, you'd honestly, after you've run the whole day, you'd fall sick. You'd lie down, and within seconds, you'd feel your back is aching, your arms are aching, your feet are aching. And I guess what our parents really didn't do much in the 90s was not explain. We'd never had that parent-children, the friendliness that we nowadays have. So, but I see nowadays parents that have children with sickle cell, they at least sit them down and they tell them, hey, you have this condition and this condition does 1, 2, 3, 4, 5. Yeah, I guess for me now as an adult, in retrospect, I'm like, my advocacy mainly is to actually tell the parents, you need to actually sit down with the children and explain to them why they are different. Don't just copy-paste and say, I've told you not to do that, do not question me, you know. Yeah, so growing up, I knew I was different, but I really didn't fully understand it. It's just the limitations that we see now, yeah.
Yeah, and I would like to pick from that, you know, and just to ask you, Selina, you know, being a mother to a son with sickle cell, you know, from what Teresa is saying, she was not explained to, why are you not, you know, letting me be like other children are just being. So is this something that you can mention also from your end? And if you had that conversation with your son, or if you're having that conversation, how does that look like?
Yeah, Teresa calls us out, especially on those evils that we've done to children. Yeah, it's very hard to explain to your child that they're different. And then it's also another thing to be overprotective, where you see, oh, don't go play outside, you'll get sick. Or don't do this, this will happen. And so half the time you keep on reminding yourself instead of reminding the child that take care. So it's us who take more care than the children should. And I remember when my son was young, it was easy. Open your mouth, swallow. Wear a sweater, shwa. You do everything for them. And it was very nice. Then he became a teenager. And he realized he had half the rights. So he would do things contrary to what I want him to do, including even medication. He would lie, sometimes he's taken. Sometimes he'd just be very tired and frustrated and ask, why do I have to take it? Others don't. And these are some of the rebellions that if you don't address early, we find that the general outcome becomes poor. And working with also many mothers, because it's not only me who was a child with sickle cell. We've managed to create a big network of mothers sharing experiences from that child being diagnosed to becoming a teenager and now becoming an adult. So when they become an adult, I think that's the freak moment for most parents, because they will want to go out. They will want to do things like any other person their age. They have desires like any other person. And you as a parent, you're still holding on to that baby. And sometimes that can actually destroy them or even affect their self-esteem. Because then, this is not an introverted child, but you're trying to bring them up like an introvert. This is a child who has feelings, but you're trying to suppress their feelings. This is a child who is very talented and can move out of your house, but you're still holding on to this child thinking that that disease is going to finish them. I'm mostly grateful that the knowledge we've had within the social spaces, especially the social media, reading about people living in other countries and what they're doing differently, has really opened our minds as caregivers to know what is it that we can do to help our children grow and become independent adults.
Okay. Moses, I want us to talk about treatment. What does treatment look like, you know, for a person with sickle cell? And maybe are there advancements that we've been seeing over the years that are helping?
Treatment of sickle cell has really evolved. If we look at way back when the treatment started, we had very limited options of treating these patients. But with new advancing of technologies, we have new commodities coming on board. And one of the challenges that we still have is that sickle cell is, the medications are still way expensive for most of our patients to afford. And the availability of these medications are also a big issue. One of the treatment, I'll just highlight the treatment that basically once your child has been diagnosed of sickle cell, this is the mandatory treatment that they have to be given. One is we have the supportive treatment, and then we have the definitive treatment. We have a component called folic acid. The folic acid, basically, we started from the onset that this child is getting diagnosed. And they use it for the rest of their life. So it's a drug. We start from the day that you are diagnosed up to God knows. We don't know when, but it's indefinite. We also have penicillin V. Penicillin V is a prophylactic antibiotic. Earlier, I told you about the recurrent infections, and one of the complications that these children have is about 80% of them in their lifetime, they get infections from the bacterial microorganisms. And therefore, this is because they are predisposed due to the nature of what we call the spleen. Most of the time, every time they are having hemolysis, hemolysis is basically the breakdown of the red blood cells, will have the impact going to the spleen, which is one of the erythropoietic tissues and one of the organs that is really responsible for making sure that you are prevented from getting the opportunistic infections. And therefore, the pen V is very important for them. We are giving them up to 5 years of age, depending on if your child has been vaccinated. We have important vaccinations, which are basically for those who are having sickle cell, and this is the pneumococcal vaccine, meningococcal vaccine, and the H influenza vaccine. So if your child is able to afford all these vaccines, unfortunate is that majority of these patients are not able to afford them.
And that is where it's quite, I'd say, disturbing, because you know, you mentioned if your child is able to afford. And this is something that someone is born with, so it shouldn't be a matter of if they should be able to afford. So you know, just from your point of view, because I know this is not all on you, right? So just from your point of view, is there something that is being done in order to ensure that we are changing this? This should be something that is given, you know, maybe freely, or should be under health coverage and all that?
Basically, a lot of interventions have been taken in place. And the other day we had SHA incorporating the treatment of sickle cell. And right now, most of public facilities, they have incorporated the use of the sexual component of treatment of sickle cell. Like, for example, there is this drug called hydroxyurea. Right now, you walk into public facility, we have from level 3, level 4, 5 going forward, they have stocked hydroxyurea. The only challenge that we have is the continuous availability of that particular drug in the facilities, especially the public facilities. In private facilities, the availability is very available. The only challenge is we still don't have it at a cost that many patients can afford. If you take a statistics like, let's say a patient who takes 1 capsule of hydroxyurea. Hydroxyurea is the formulation. We have two types of formulation, which is basically the syrup formulation and the capsule formulation. Let's take a simple one, who takes 1 cup in a day. The cost ranges between 15 shillings up to 60 shillings. So depending where you are. So let's talk about that patient who is in remote area. That patient who cannot afford a meal in a day. Will they be able to afford the hydroxyurea or to put the food on the table? So we'll realize that majority of these patients, they still suffer in silence because the cost of these medications are still very high. Their availability still another issue. So, but the SHA has come in place. And most of public hospitals right now, you walk into any facility on the public hospitals, then having a SHA. That is why even in our facility, we still encourage every patient who comes. As in Baraka Healthnet, we are a non-profit organization. Therefore, the cost that we charge is way minimal for these patients. But still, we do an outpatient services. And one of the things that we know, in one way of their life, they will have to be admitted in the hospital. In the event that you get admitted, what happens? That is why we still emphasize for them that all our patients must enroll on the SHA uptake. That will make it very easy in the event that you are going to be admitted. One of the things that comes handy is blood transfusion. Most of these patients, in one way of their life, they'll be transfused. In the event that they get into inpatient, this is now where the SHA comes handy for them. Yes.
Right.
And
So,
the other thing is about different stakeholders. We have, for example, the Children's Sickle Cell Foundation. We have other organizations that have come in place. They have really tried to negotiate for these patients, especially the different, for example, the availability of the hydroxyurea. In the early years, it used to be, you could find hydroxyurea going up to 60 shillings. But right now, majority of the facilities are ranging between 15 up to 30 shillings, courtesy of these organization groups which are basically championing for the welfare of those people who are living with sickle cell and who have been affected by sickle cell.
okay.
Yeah.
So clearly there is still a gap there in
Yes.
matters accessibility to specialized care. And even as we approach the World Sickle Cell Day, which is
Yes.
why we are having this conversation, it's going to be on Friday. I hope these are things that we'll keep sensitizing on and championing for, so that we get to at least have a solution for that mother who is not able to even afford that 15 shillings for that. Teresa, maybe if you can just let us know, are you on medication every single day, and what medication are you on?
Oh, you have to be on medication every single day. Hydroxyurea, folic acid. On the pen V, once in a while, I can't afford, let me just be honest. Medicine is a bit expensive. So I know I have to be on hydroxyurea because that's the one that at least keeps you safe from being sick all the time. It's the one that helps you develop, Daktari, what is the nini? Fetal hemoglobin.
Fetal hemoglobin.
Yeah, so at least it helps you not fall sick a lot. That one you have to swallow, but as per what the doctor says, it depends on your age, it depends on your weight, it depends on a lot of factors. So I have to be on that, and I have to be on folic acid. In as much as I also believe in eating really well, those ones help at least to keep you safe here.
So, you know, what would be your, like, the call to action, you know, as someone who's living it, living it in the sense of you need to incur all these costs. As a caregiver as well, you need to incur these costs. What would be your, just for someone, maybe for the relevant authorities who may be listening or watching us this morning, what would be your word?
Talking about that call to action, first of all, according to the national statistics, they say every year 14,000 children are born with sickle cell disease in this country. Out of these 14,000 per year, how many make it to the age of 5? We still don't know. So we need to have a national registry that determines how many people are affected by sickle cell, by location, and also just where they attend their clinics. There's been a lot of training that has happened in this country, and I'm happy because when we were there were a few doctors who understood sickle cell. But today there's a lot of capacity building that has happened. And I'm happy to say that just recently there was a group of clinicians who have been attending a preceptorship training, which has also built the capacity. But then when you take this person to a facility that is not well equipped, what are you telling them? Because when you go there, they cannot diagnose. They cannot dispense medication because it's not readily available. The health funding is a bit wanting because if you tell this person, go buy this medicine and they don't buy it and the next time they come, it's a gap. So my call to action is, can we have facilities that are well equipped and can also match the capacity that is being built to support people living with sickle cell? We have 18 counties in this country which are heavily burdened by sickle cell. How can these 18 counties be brought up to speed so that if I walk into any facility, I do not have to worry if they understand me or not. I can tell you for a fact that today many people living with sickle cell fear to travel around the country because they don't know if I get there and they don't understand me, how will I survive? And so you want a place where your emergencies are treated as emergency. You want a place where you are known for who you are and not every time they start querying. I'm happy that the Ministry of Health, in partnership with many other stakeholders, are thinking about this national registry. But all I can ask is how fast can it be done? We have SHA now accommodating part of sickle cell care, but it will only be practical if we already know that this is what SHA covers and this is what these facilities can give. And I'm also very grateful that most of our private facilities are stepping up to make sure that what is the gaps that we are facing within the private facility, within the public, they also make up for it. But it is not everywhere. It is not everywhere in this country that you will find people complementing each other's services. In this country, we have more than 40 organizations that work with sickle cell. We work under an umbrella body known as the Sickle Cell Federation of Kenya. And under this, we are trying to bring our voice as one voice, saying that Kenya is in need of proper structures to be able to care for people living with sickle cell.
All right. Maybe Teresa, as we almost come to a close of the conversation, what would you say are some misconceptions around sickle cell that you would love for us to demystify today?
One, we are not weak. It's an assumption that now maybe if you have sickle cell, you're supposed to dim down. I remember, like, I'm a very active person, by the way. I own a business, but even in my younger days, in my early 20s, I used to be very active in church. I used to be very active. And I'd hear my mom always running to the youth leader and telling her, please just give her less roles. But I'm like, no, my cognitive ability iko huko juu, so I want to do many things, and I want to show other people that have sickle cell, hey, in as much as you cannot maybe do exercise, you can do like 110 things. You can capitalize on your talents. You can be a designer, you can be so many things. You can be a church leader, you can be in the worship team, you can be in the drama team, you can be everywhere, as long as at least it's not constraining you physically. I feel people feel like we are not supposed to do a lot, but yes, we have the ability to do a lot, but maybe in a capacity that only us can understand. I can say, I can't climb Gong Hills, but for sure if you give me a program to run, I will run that program and you'll be like, yeah, call her again, we do it again, you know. So I feel, one, don't limit us. Parents should also be able to at least loosen the harness and say, okay, you want to do 1, 2, 3, 4, 5.
Just looking at you.
Yes. Do 1, 2, 3, 4, 5, but please remember, hydrate, take care of yourself, wear a sweater when it's cold, you know, do the precautions. But live your life fully. Don't live your life limited or thinking that the disease is something that will hold you back. No, it's not. In fact, it should be the plus. You'd be like, yeah, I am Teresa Adhiambo, I'm a fashion designer. I do 1, 2, 3, 4, 5, but I'm also a warrior. That should just be like a plus on the side.
I love that. I love that. Do you feel like there's still stigma?
There is a lot of stigma. It's been unfortunate and unfair that many of us do not really fathom or know what sickle cell is. So because of that barrier, you'll find maybe people are not dating those who have sickle cell, or people are not hiring those who have sickle cell because of certain fears. But that's actually why we are advocates, because we try to educate the masses and try to tell them, by the way, this disease is not something that's contagious, 1, or 2, it should not be able to say that we are lazy or that we are limited. We are not. Yeah.
All right. Moses, yes. There's something you had mentioned. I want us to touch on it a bit, on the late diagnosis.
Yes.
You know, you mentioned it can be as late as 15 years. So is there an effect, or are there effects of late diagnosis?
Yes.
Yeah.
Basically, the earliest you are diagnosed, the better the quality of life you'll get. Because remember we talked about this abnormal hemoglobin, which is the S. These patients, they are getting late diagnosis, not that they didn't have the disease, but it could be a system failure. We know of areas that a patient walks into a facility, the facility is not equipped enough to make a diagnosis of sickle cell. We are talking about excellent centers of excellence. What are these centers of excellence? These are centers that have got the gold standard screening tool and diagnostic tool. You get a patient that you suspect could be having sickle cell. You refer them to another center. It is possible that you might get lost of them on the way. The other thing is that, well, about the misconception, we still believe that sickle cell is a taboo. It's something that, like a witchcraft. So you end up losing these patients into the herbal medicine. You end up losing these patients into other practices. So by the time they'll be coming back to the facility, it will be too late. These are the people now come at 15 years. Already we have those late complications. Like one comes already having a stroke. One come already having we call them leg ulcers, which is very chronic, not able to be managed at that time. Those who comes already have a vascular necrosis, all the hip is already gone. So these are things that will be as a consequence as a result of getting late diagnosis.
Okay. Yeah. I want us to speak about this, and I want you, Selina, to be the one to do it, and I want you to do it in less than 30 seconds.
Wow.
For a parent, mother or father, whose child has just been diagnosed with sickle cell, what is your word for them? That's your camera. Very quickly.
For any caregiver who has discovered their child has sickle cell anemia, there's hope. The first thing you have to do is get connected to a facility, make sure there's regular checkup, and just follow the rules of the doctor. There's no other person who will guide you better than the doctor who is seeing your child. Thank you.
All right. Thank you so much, ladies and gentlemen, for this very useful and needed conversation and a sensitizing conversation on sickle cell. Remember, we get to celebrate World Sickle Cell Day on the 19th of this month. That will be on Friday. So let's spread the awareness on sickle cell, and let's also be able to just shun that stigma against sickle cell. This is where we end it. My name is Vivian Degwa. We do this each and every Tuesday where we talk matters health. So be sure to join us every Tuesday and every single week for Good Morning Kenya. Do have a good day. Do have a good day.